talk about your wife, Lynn, and I know her for now 3 years. She's come to every visit with you. I was actually quite nervous because when you deal with young men, obviously, beautiful young wife, sexual function is a big deal. And this smart technique that we developed has actually resulted in great sexual outcome. About 80% of the patients are doing quite well. And that's what I want to hear. What was your role, Lynn, that you played in this whole relationship? When I talk about Samadi Challenge, I talk about the role of women for men's health and how women are the ones that bring the husband, say, go get tested, get it out, and we're going to find the right person to get us the quality of life.
Right. Well, one of the things that Ron and I have in common, and it's something that I heard you say, which I think is extremely important, is that you have to think for yourself. You can't just blindly follow your normal physician. You can't blindly follow the media or the guidelines. You really have to take your own health into your own hands. So we did that right away, starting with when we noticed that the PSA was high. So we investigated everything, and in meeting with you, Dr. Samadi, it was very clear. You're not only a brilliant surgeon, seriously, you're one of the nicest men and doctors I've ever met.
Thank you.
You
Absolutely.
put us at ease immediately, and that is so important, especially with something like this, because you're dealing with two options. You're dealing with the possibility of great suffering if you don't take care of it, and you're also dealing with the question of quality of life on the other hand if you do. And both of those things are very nerve-wracking, but you completely put our mind at ease with
Well,
that.
you know, I appreciate the comments, and I certainly, every time I see a patient like you guys, you want the best outcome for your patients, and you want to fight for his life. It's one of the reasons why I always perform the entire operation. And when you, as his wife, waiting in the waiting room upstairs or on that floor that we have built for you guys, you know that we're doing the right thing for him, that I'm in the room all the time. 100% of the surgery is done by us. Years and years of commitment and passion has gone into it. But when I met you guys the first time, Ron's face was like, what the hell am I doing over here? I have no symptoms.
Yeah.
Why is she dragging me over here? And then possibility of having incontinence. The guy plays bass and drum, and the last thing you need is a drummer who's in diapers. And I'm glad that and I'm glad that your quality of life is doing well. How are you doing as far as your sexual function, your continence, now that the whole world knows about it?
Well, really good. I have to say, I don't need any medications, and everything works really well. And my wife's always got a smile on her face, so that ought to tell you something. No, seriously, I mean, your handling of the whole thing is amazing because you are there through the whole process. One of the things that was so important was making sure that the person I'm talking to who's telling me everything is actually doing the surgery. That is a big thing. Your follow-ups are always with you. You are, the ultimate for a person going through this on so many levels. And I can honestly say I have extreme confidence in recommending you, or if I know there's a situation where someone may even have a symptom or not, or just wants to talk to someone regarding this, I know that you are going to, putting them in your hands is an amazing thing. It really is. And my life couldn't be any better since having this surgery than it has been.
I'm very happy for you, and I think this speaks about the whole concept of screening. And while there's a lot of debate and confusions, even among urologists, we have these debates on our national meetings. I think it's important, especially if you have family history, you're at high risk, you're a young guy, and we know when we find the prostate cancer in young men, they're actually quite aggressive. Get tested. Knowledge is power. Without knowing what your PSA is, you're going to be in a lot of trouble. But
I was going to say, and that's exactly it, because with both my husband and his brother, there were no symptoms at all, nothing. We didn't even think that that could be a possibility. The only reason we started looking at it was because we had the PSA testing, and I think it's so important because we wouldn't have known.
well, that's why they call them silent killer.
Yeah.
Now I want to talk